Hi, I'm Brad Power, and this is our weekly lightning update. Thanks for all of you who are joining us, and we're recording this so that people can watch who have a conflict right now. Linnea will give us an update on where things stand, the progress she's made. And we've got a few people on the line that we can cue to give a little bit of color from some of the tests that we've done or are potentially planning to do. And then we'll try to keep this to about 15 minutes for the formal part of the conversation so that people who are looking at the recording don't have to look at something that's too long. But we'll also continue, as we did last week and before, just sort of having a free-form discussion for those who want to stay on the line, kind of a clubhouse for Linnea, if you will. So Linnea, you want to kick us off with the kind of the update where things stand?
Sure. I submitted plasma for 2 blood biopsies, and Foundation Medicine has come back with their report that there was nothing found that was diagnostic. And I spoke to my oncologist about this, and she said it was not surprising because my overall tumor burden is still rather low. So I discussed with her the possibility of having a tissue biopsy because I've not had one that returned results for us for 3 years now. And this is the longest I've gone with multiple treatments without having a biopsy. And her feeling was that we should wait until the results of the blood biopsies came in, and then we could revisit. And she was a little hesitant because it is an invasive procedure. I have had lung collapses on multiple occasions in the past, but she also said if it was something I was determined to do, she would back me on it and make it happen. So that's a possibility. I also met with Citizen, signed up, so they will be requesting my data and storing that for me. And then I just wanted to give you a quick personal update, which is that I feel so good right now because I'm only getting 1 treatment, and this is the best I've felt in a long, long time. So I'm trying to balance everything in my life, and I'm painting my ass off because that's my true vocation. I'm an artist. So I'm in the studio every day, and that's pretty flippin' exciting right now.
Great, congratulations.
Thank you.
So let me cue, so Linnea mentioned a few of the generous folks that have come forward to say we can help. And so that's Foundation, Lucense, Path Presenter, and Citizen. David Marshak, a Foundation, anything you wanted to add about Linnea's blood biopsy?
So I think that's great, Linnea. Talked with Dr. Lynn about the implications of the results. And I think, you know, when you get a valid test result, meaning not a failed test result, but you just get a test result that says there are no alterations found, that is helpful information, and that can inform your next steps. And it sounds like you were talking to Dr. Lynn about what that might mean for you. And I'm also, I think I mentioned my email to you, Linnea. I'm having one of my colleagues in medical affairs look into your report a bit more to see if she has any thoughts to add to what you spoke about with Dr. Lynn, and we'll follow up with you.
Great, thank you.
You're welcome.
Thanks, David. So Jack Chalice, how about Lucense? Where do we stand on the Lucense test?
Hi. So Linnea, we are finished with sequencing. We did request some documents about previous biopsy information or therapy information so that we can inform your report, and we look forward to getting that to your physician promptly.
Great, thank you.
Kimmery, just a little discussion about Path Presenter and the possibility of doing sort of a pathology analysis of Linnea's scans. Because we had that conversation on Friday. Anything you want to add on that area?
Sure. First, I have a question about the foundation test result. There's nothing diagnostic, is how you put it. And sorry, I'm getting a scam. Sorry about that. David just said no alterations. Does that mean clinically actionable in terms of, how the report is listed in terms of there are drugs for these, but were there any at all, even potentially non-actionable alterations in the report?
Linnea, do you want me to answer?
Please.
My understanding is, and I should give a disclaimer, I'm not a scientist or a clinician. I'm on our patient engagement team, but my understanding is that there were variants of unknown significance, but no clinically actionable alterations.
So it would be good to know what those are, just in case there are some, drugs in development or even early pipeline, just to sort of keep an eye on that over time. That's the only question I had about that. So yeah, Path Presenter. Path Presenter is a digital software platform that hosts digitized radiology and pathology images for the purposes of being able to do artificial intelligence analyses on these images. And just to really simplify that, I'm not an AI scientist, but essentially these images have contained tons of data within them. And going through pixel by pixel through these images, it's possible to abstract features that may be indicative of either tumor behavior, sometimes predictive of treatment outcome, predictive of things like hyperprogression or disease flare, things like that. So we had a discussion about whether or not it would be possible for Linnea to house all of the radiology images that she has, and she has a large collection of them from throughout her journey so far, and also getting access to any pathology images, which sounds like it might be a little more challenging, given that it's my understanding that a lot of her tissue was given up for research purposes, so we probably wouldn't be able to get every sample back. But all we really need is a diagnostic slide that's called the hematoxin and eosin stain slide, or the H&E slide, from her baseline diagnosis. So the idea was to just house these and do exploratory analyses, because there aren't really any algorithms that are ready for prime time prediction, but it's the possibility to be able to abstract some behavior or features of the tumor over time throughout the course of all of her treatment.
Yeah, so just for those who don't know, we have a number of pathologists. John Spinoza's on here, Devin Snedden from the College of American Pathologists, or Pathology. And so we can almost like run a mini hackathon just on the scans and see if there's anything that's new that people haven't seen. And so Kimmery could provide the infrastructure with Path Presenter to make that as a possibility. So it's just one of the nice things about the hackathon, that we can draw enough people to do this vector. It may turn up something or it may not turn up something, but it's one of those nice features. So I just wanted to let people know about that. Sophia, can you talk about Citizen? Anything you want to add to what Linnea said about Citizen?
Yeah, Linnea got to meet Mikkel, who leads our patient support team, and our records team is prioritizing your requests to Mass General, and so those should be available probably early next week. Mass General, in general, is very quick with our requests. If there are any other providers that you have results from, I heard you mention Foundation Medicine, any other diagnostic or imaging centers, we will go get all of that data as well. Don't rely on Mass General pulling that for you, just because it's usually a subset and only what they really need. And so you can go in, and now that you know Mikkel, text or email her just with the name of your providers, and she can do that for you. So you don't even have to log back in. But we will have updates for you probably middle of next week as all that is available. And per the citizen philosophy, you, Linnea, can control who gets access to that data. So if this entire group is a body you want to make that available, you can either share your credentials or individually add people to what is called your care team, where you enter everyone's email addresses, and then you all would get a secure link that says Linnea has invited you to view her citizen profile, and you'll have full access to all her raw medical documents, images with a radiology viewer, so you can see all of that right on the platform, as well as what is called our cancer summary. So our clinical team takes all your records, extracts the data, and creates a summary so that hopefully that snapshot can help anyone who touches your case get up to speed, both with the recording you did 2 weeks ago, as well as that summary. So that will be ready hopefully by middle of next week. And Linnea will provide you updates. And then maybe by next Friday, you can kind of share out with this team kind of what you want to do with your data. We won't decide for you.
Great, thank you.
Tim, I don't want to put you on the spot, but Tim Stallmiller of XCures and Cancer Commons is also, Linnea is also in process with them in terms of hosting. Basically, the strategy that I've suggested Linnea take is whenever anybody offers to host, that we do it. So, because you can have multiple people hosting her data, and then whichever is the best service for the purposes can use it. So potentially that's Path Presenter, Citizen, and XCures. Tim, you want to say anything about XCures and where you stand with hosting Linnea's data?
Yeah, I mean, I think you know what Sophia said about Citizen. We have analogous platforms and processes to do the same thing. So we would, we basically just reach out to your institutions and centralize the raw data and abstract data elements into our database and surface those in a dashboard for you. Again, kind of analogous to what she said. In addition to, if we're going to get a bunch of viewpoints from oncologists, we have a really simple online chat software that we can just kind of ping a bunch of oncologists and let them comment on the case as they look at the data.
So I'm going to, it's been 15 minutes, so I'm going to stop the recording here. That's the kind of the update, the formal part. We can have a ongoing conversation then about, there's been some interesting things in the chat about other hypotheses and tests and ideas, but I will put that in the optional section. So if people are in a hurry and need to log off, we can stop here. So I'm going to stop recording, and